Atlanta is one of 16 host cities across North America, preparing for massive global fan traffic. The Benz is guaranteed to host 8 games in the World Cup, including one of the semifinal matches. That's huge. So excitement for the global tournament ramped up Friday as FIFA conducted the group stage draw, determining which national teams will come to Atlanta. 48 nations in all are set for the 104-game tournament, which kicks off June 11th in Mexico City. So with the World Cup will come a massive wave of global fans and big business. And folks here are working to make sure the city is ready for the opening face-off. So let's now welcome in Paul Kane, president of On Location, the official hospitality provider for the FIFA World Cup. Good morning, Paul.
Good morning. How are you?
I'm great. Thanks so much for being with us. So how does the energy around a World Cup host city change the moment teams are assigned?
So once the draw was assigned, all of a sudden you saw all 16 cities just light up. People got very excited because now you're starting to get to know the teams that are going to be playing in those first couple of rounds, the first round, I should say, in each of the markets. So Atlanta's got some great matchups too, so I'm pretty excited about that.
Yeah, we get to have Spain here, one of the best teams in the entire country. And from your perspective, what does Atlanta stand to gain, both economically, culturally, as a World Cup host city?
Well, Atlanta's not, Atlanta's hosted before different really big global events, from Super Bowl, the Olympics, the Final Fours. I mean, Atlanta's just known for being that kind of city.
Yeah.
And when the World Cup comes into Atlanta, it's going to light up everything. Restaurants, hotels, the city itself will come to life. It's just going to become such an exciting time to be in Atlanta.
Right. So Atlanta, no stranger to these kind of events, and your group, On Location, no stranger as well. They're delivering FIFA's largest hospitality program ever. So what does that scale actually look like behind the scenes?
I mean, look, when you have 104 matches, everything becomes, one, exciting and then also complex.
Yes.
And we at On Location, we are the largest. We do the Olympics, we do the Super Bowl, we do the Final Four, we do all the major global events when it comes to ticketing and hospitality. And for something like the World Cup, first, you want to make sure you have real tickets. Buying your tickets from the hospitality is going to make sure they're confirmed and real. Secondly, is you want to make sure your experience is extraordinary. And On Location is set up, along with our partners at FIFA, to be the most to make this event be the most exciting thing you've ever attended.
Yeah, you bring up a good point. There are a lot of scams out there. There are scalpers offering outrageous prices. So buying from a certified seller, very, very important. And you're promising immersive, culturally inspired experiences in every host city. So you're going to be, of course, in Atlanta as well. How will that show up here?
So one is, if you're one of our guests, you're going to have the opportunity to get the best of Atlanta when it comes to food, culture. We're going to bring not just the Southern comfort food that Atlanta is well known for, but from cuisines around the world.
Yeah.
I mean, you've got Spain playing, Cape Verde, Morocco, Haiti. So you have an opportunity to be a host for all these guests coming from all these countries, but also people from around North America who are big soccer fans. Remember, this is the world's largest event coming to North America. It's in 3 countries, Mexico, North America, United States, and Canada, 16 cities, Atlanta being one of the more important ones.
Yep.
So you're going to have people from all over the world really to get the culture and the food and the excitement that Atlanta has to bring.
We call it the world's busiest airport, but that title will certainly be put to the test in the next 12 months or so, with major events like the World Cup adding to its normal hustle and bustle. And new data is showing travelers want modernization, and they want it right away. The U.S. Travel Association reports more than 4 out of 5 people support TSA to use facial scans and other biometric tools. And most travelers also say easing the liquid ban would also make airport security far less of a hassle. However, Americans overwhelmingly worry the current system can't handle the surge, with just 19% saying TSA is even ready for next year's World Cup. Time to bring in Eric Hansen with the U.S. Travel Association to look at what's fueling this reaction. Eric, so glad to have you here. All right, so we know that the World Cup is going to be a huge undertaking. A lot of people flowing into Atlanta's airport. So when you look at the data and all these points together, what is the big message that you think travelers are sending?
They're sending a message that the travel process today is too much of a hassle, and they want a better system. And this is not a partisan issue. We're seeing across party lines, across the country, Americans are crying out for a better travel experience.
Yeah, and so I just used the word earlier, modernizing. So when we talk about modernization in the airport security, what does that actually mean practically for the average person heading into security checkpoints?
Well, it means that you can have a better experience through technology. I mean, think about the number of times that you have to pull out your identification. When you check a bag, when you check in for the flight, when you get to the airport TSA process. We can get rid of that. We can use biometrics where you can keep your ID in your wallet and you can move through a lot faster. Think about taking out your laptop or your phone before screening, or taking out your liquids and dumping out your water bottle. We've got the technology today where you wouldn't have to do that in a more modern experience. So we're very close to being able to have a faster process. What we need is the funding to purchase that technology.
Yeah, and that was kind of going to lead to my next question. You know, we've had the same basic TSA system for about 20 years or so. Other than, you know, some small changes, I know now we don't have to take off our shoes generally when going through checkpoint. But what's the biggest structural barrier to the change? Is it the money that you just spoke of?
Well, it comes down to funding. Every time you fly, you purchase a ticket, between $5 and $11 is supposed to go to modernizing the process, investing in technology. The problem is that Congress started taking that fee about a decade ago, 75% of it, and using it for things that have nothing to do with travel. So every time you go through the checkpoint, Congress is picking your pocket. What we need to do is make sure that all of that is invested back in the security screening process, and we could have a better experience within just 5 years.
Yeah, and how big of a deal is this right now? We're talking about, you know, just being months away from the World Cup, where we're going to have, you know, thousands and thousands of people flowing in and out of different airports, including here in Atlanta. So how big of a deal is it to really focus on this right now?
We've got to focus on it now. The World Cup is going to be the largest sporting event in human history. As you mentioned, thousands of people come into the airport all at the same time, a very focused period. And so we've got to make that process not only safe, but more efficient if we're going to avoid lines of 30 or 40 minutes during these peak periods. But even more than that, the busiest day next year is going to be the average day of flying in just 5 years. So we've got a limited amount of time to get this right.
Yeah, and so speaking of time, though, what is the realistic timeline? If we've got to make some of these changes pretty soon, could it happen this year? Or, I mean, well, obviously the year's about to be over, but this coming year, or will it be something we see a little longer process?
Oh, if we move quickly, we could see a more modern process at World Cup airports within the next year. You could see pre-check travelers, for example, not having to dump out their water bottles before going through the checkpoint. That'll make things go faster. So there are things that we can do quickly at select airports, but even just within the next 3 to 4 years, we could have a lot of these same improvements if we make the right investment.
As we move deeper into this flu season, health officials say early numbers look moderate, but a new strain and low vaccination rates could shift the outlook quickly. The CDC has logged close to 2 million illnesses so far. They've also cataloged 19,000 hospitalizations nationwide and 124 million doses of the flu vaccine distributed. Those numbers show a manageable start, but officials warn a newly emerging flu strain could accelerate spread if vaccination rates remain low. So let's break down where flu activity stands right now with Dr. Sandy Freihofer from the American Medical Association. Good morning, Sandy.
Good morning, Rachel, and thanks so much for having me this morning.
Thank you. And you have some local ties. You're in New York this morning, but got some ties here in Atlanta as well. Is that correct?
Right. I'm an internal medicine physician, and my office is right down the street from where you are, but I'm not here now. I'm up in New York to give you this message, and I will tell you, it's very cold up here. It sounds like it's getting warmer in Atlanta.
Yeah, we've been complaining about the cold, but nothing compared to what you're seeing. So, Dr. Freihofer, as we enter the heart of flu season, what worries you the most?
Well, I just want everyone to get protected. Everyone 6 months and older needs to get a flu vaccine, and you need to get it every year. As you mentioned in the introduction, flu season is just getting started. It's off to a slow start, so it's not too late to get protected. It takes 2 weeks to build up antibodies, so get your vaccine now. And we have a great website that we can refer you to if you have any questions. It's called getmyflushot.org. And this has been put together with the American Medical Association and the Ad Council. And it's a great resource if you have some questions about the flu shots, if we don't answer them today.
Wonderful. Answering people's questions really important, especially when people have concerns about vaccines. So what do we know right now about this newly emerged subvariant named H3N2? Because that's one of the most pressing reasons why vaccinations are being pushed this season.
Well, we are seeing a slow start, but you're right. This subclade K that you mentioned is showing its face. But understand that the flu shot covers 3 strains of flu, 2 flu A's and 1 flu B. And some early data shows that even though it's not a perfect match for subclade K, it seems like it is going to give us a head start. And getting a flu shot is your best way to stay protected and get a head start on if you happen to get the flu. And getting a flu shot not only protects you, it protects everyone around you.
Yeah, and when you look at the trajectory of past seasons, what do you expect to see over the next 6 to 10 weeks or so?
Well, every flu season is different,
Yeah.
so we don't know until we're right in the midst of it. But this year's flu season comes in the after one of the worst flu seasons ever. Last season was one of the worst we've had in this century. We had more hospitalizations and more deaths than we've had in 15 years. And 280 children died in last year's flu season. And of those children, 50% had no underlying medical conditions. 50% of those children were healthy, but almost 90% of those children who died had not gotten a flu shot. A flu shot is so important. Everyone 6 months and older needs to get a dose of flu vaccine.
Yeah, and of course, even if you're not worried about your own health, you can worry about the most vulnerable, as you said, children, the elderly. But, you know, those vaccination rates are lagging. We have a short time here left, but what do you think are the biggest barriers that you're seeing to folks getting vaccinated?
Well, I think people, number one, need to realize that the flu season's here and you need to get the vaccine. But let me also share this year's flu season and the importance of getting a flu shot has a special meaning to me. My husband is just getting over chemotherapy. I have boy-girl twins, and both of my twins had little babies right before Thanksgiving. So a flu shot is recommended for everyone 6 months and older, but my little grandbabies are too young to get vaccinated. So they depend on everyone around them to help them stay protected. So this year, this is a holiday season. Protect yourself, protect those around you, and everyone, please get a flu vaccine. If you have any questions, again, that website is getmyfluvaccine.org. A great resource, lots of questions, but do it today. It's not too late.
The days do get shorter and the temperatures drop. Thousands of Georgians start feeling more than just the winter chill. Seasonal affective disorder is far more common than a lot of us realize, especially for older adults. Those darker days can also bring some real health risks. So listen to this. The U.S. Census Bureau puts the number of adults 65 and older in Georgia at 1.6 million, which is a large and growing population, many of whom are more vulnerable to the emotional and the physical impacts of shorter winter days. The National Institute on Aging says prolonged isolation carries the same health risks as smoking 15 cigarettes a day, which is a major concern, of course, during these winter months. And they also add that social isolation and loneliness are not just emotional challenges. They can reduce life expectancy by as much as 15 years. 15 years. So let's look at some of these numbers this morning. We've got Dr. Marcus Griffith joining us this morning. Dr. Griffith, good to see you. You're a psychiatrist with Kaiser Permanente here in Georgia. So let's talk about this, because a lot of people, you know, they may feel down, but how do people know that this may be seasonal affective disorder? How is that different from just kind of feeling a little down during these days?
Yes, thank you, Jonathan. Good morning. And it's great you're highlighting such a common condition. So seasonal affective disorder is not just winter blues. It is a mood disorder, a mental health condition that we see that's more prevalent in persons in northern hemispheres. So the further one is away from the equator, the more likely someone is to have seasonal affective disorder. And so with this, you will see persons who have a pattern of more depression, more sadness tied to the winter months.
Yeah, and you talk about this because I think a lot of us, we know people who may be dealing with this but don't necessarily get diagnosed, if you will. So do you think it's underdiagnosed, or just a lot of people don't understand what maybe our neighbors or our grandparents, for example, may be dealing with?
Yes, clearly underdiagnosed. Many times depression and anxiety disorders go undiagnosed and untreated due to fear of being stigmatized or shame. So older adults may be more prone to mood, depression, social isolation. COVID really helped to bring this into highlight how we need to socialize, engage, and interact. So many persons who are older adults tend to be more lonely, can be more isolated. So things that we can do to help them would be, if you've got a neighbor, a friend, a loved one who's alone and isolated, reach out to them, encourage them to get out, go to their community center, their church or synagogue or mosque, a recreation center. To engage in other people can not only help with social isolation and loneliness, but can help to promote their mood and improve their mood as well.
Yeah, a lot of us, we felt that during COVID, being isolated, a lot of us were alone or spent time away from our loved ones. But how do you know, Dr. Griffith, when this is more than just a bad week that you're feeling down? When do we know that we need to call you or a mental health professional and get some treatment?
Yes, so when we have more consistent periods of sadness, hopeless, loss of energy, maybe even thoughts of hurting oneself. And there are resources and access. We have 988, so anyone can call 988 and get immediate counseling at the time. If you were perhaps, afraid to go see a psychiatrist or mental health professional, you can see your primary care physician, who's very versed in helping persons with depression or anxiety. Most older adults have Medicare and health insurance. If you're a member of Kaiser Permanente, you can look on the back of your card, you can call us, we'll help you at any time. But any insurance company has 24-hour behavioral health assistance. So we encourage people to not isolate, to reach out, to get help, because everyone at some point in their life needs help.
Yeah, in the midst of all the things going on in the world with the economy, people dealing with job loss and other factors that can make them feel sad in addition to this. So what can we do when we talk about family members? We obviously can go get help. We can seek treatment with people like you. But let's say, somebody like me, how can I help a friend or a family member who might be feeling withdrawn or sad as the days are getting shorter?
Yes. So some very simple processes are simple check-ins. Check in with them, every day. If you can't do it, perhaps a neighbor can. Encourage healthy behaviors, such as, and during the holidays, lots of people want to, have hot toddies and various, holiday martinis. But alcohol can actually make sleep problems worse. It can be a depressant in itself, and it adds to weight gain. So limit alcohol consumption. Increase your social interactions. Daily exercise can help. And if you have more profound and significant mood or affective symptoms, again, reach out to a health professional. A health professional could be your primary care physician, but also it could be, a psychiatrist or a psychologist.
There is major progress in Atlanta's fight to reduce homelessness downtown. The city's Downtown Rising initiative has now housed more than half of the people once living unhoused in the heart of the city, and it's marking a key milestone toward its 400-person goal by the end of next year. The group Partners for Home reports more than 200 Atlantans are now housed downtown. More than half of those once living unhoused in the area now have a roof over their head. They say that chronic homelessness is down 9% in Atlanta, with more permanent housing options driving the decline. However, Nationwide, homelessness is up 18% this year, including a 14% spike in family homelessness. But behind each number is a person and a story. So what does this midpoint really mean, and what comes next? Joining us now is Elizabeth Banks, COO of Hope Atlanta, to break down the impact and the road ahead. Elizabeth, good morning, and thank you for your time.
Good morning. Thank you so much for having me.
You know, we're talking about 200 people housed here. It sounds like a huge milestone. Help us make sense of that number and what it tells you about the pace so far.
Yeah, housing 200 individuals, really think about those are 200 different people with different stories that have led to their homelessness, and being able to house them in safe, affordable, stable housing is game changing for their life, but not just their life, the impact that it has on the community, as they're our neighbors as well.
You know, nationwide, we mentioned homelessness up 18%, and yet here in Atlanta, we're talking about a 9% decline downtown. So what is Atlanta doing right? What's working?
Yeah, so Atlanta is really working on collaborating across systems. So Partners for Home is really managing the strategy. The city of Atlanta is really helping with implementation. And then service providers like Hope Atlanta are providing the direct supports that are needed to get people into affordable housing and to make sure that they're able to stay housed once they're into affordable housing. In addition, really building more affordable units and really focusing on making sure that not just housing alone, but housing with those supports.
Yeah, that brings me to my next question. I'm curious, once they are in this house, what you have to do to keep them there, and what kind of challenges present themselves at that point?
Yeah, so every individual we work with has different needs, and that ranges from workforce development support to benefits navigation to behavioral health needs to substance use needs. And so really every case manager that we have on our team and that other providers have as well is focused on creating an individualized plan for that person, and then teaching them how to be a good neighbor, how to reintegrate back into normal day-to-day life, being able to increase their income and provide them the supports that really allow them to stay in housing so that they're not returning back to their homeless situation.
Is this model scalable beyond downtown or other parts of the city or region?
Yes. So this model has been used across the city of Atlanta over the past couple of years. And so it's definitely scalable. It's really focused on street outreach, meeting people where they are, getting them into housing, and then working with them for a year or more to make sure that they're able to maintain that housing and get access to all of the services that they need to be able to get to self-sufficiency. So it's definitely scalable and has been done in other parts of Atlanta as well.
Did I hear right that the goal is 400, to get 400 housed? What needs to happen to hit that goal?
Yeah, so continuing to have government, public-private partnerships, continuing to make sure that we're building and investing in affordable housing, that we have support services and funding to support services, and investment in housing first options to really get people into housing and then focusing on the rest of their needs. So continuing that work and continuing to develop new partnerships and new investment with financial and time, talent, treasure is what we like to say, investing your time, your talent, and your treasure into doing this work.
As opioid deaths climb nationwide, Georgia is taking a new step to save lives, putting Narcan kits in every public school by next spring. Let's talk more about this, what this means for students, staff, and families across the state with Kevin Tanner, the commissioner of the Georgia Department of Behavioral Health and Developmental Disabilities. Good morning, Kevin.
Good morning. Thanks for having me.
Of course. So how do you explain to parents in simple terms, as a parent hearing opioids, hearing that this is necessary could be alarming? Tell us, why is it necessary to have in a K through 12 setting?
Yeah, so in Georgia between 2010 and 2022, we actually had a 302% increase in the number of deaths caused by opioid overdoses. And we've had overdoses in the last few years in Georgia public schools. So we felt like with the passing of Wesley's Law in 2024, which encouraged opioid prevention, naloxone to be placed in all Georgia schools, that we felt like this was a positive step in the right direction.
Mm-hmm. And speaking to those numbers and the overdose deaths in the schools, what was the tipping point that convinced the state that, hey, we really do need these Narcan kits in every public school, not in just some districts?
Yeah, so one of the challenges around Georgia is when the state passes rules, regulations, laws, or encourages schools to do things. Some schools are very able to have the funding to do these things. Some of our more rural schools are more challenged. So we heard from superintendents, we heard from principals that they would like to have the product, the naloxone, the Narcan in the schools, but oftentimes they were challenged to be able to do that. So we wanted to take the financial barrier out of the picture, and we wanted to provide that product for every Georgia school.
Mm-hmm. And, you know, speaking with principals and teachers who have close knowledge and experience working with these students, what does an overdose emergency in a school actually look like, and how quickly can Narcan turn that situation around?
Yeah, so the challenge that we saw over the last several years is someone may not know that they're taking a product that could cause an overdose. They may be taking some medication that they think is for maybe it's Xanax, maybe it's something else, it's to help them study, but it has fentanyl mixed in with the product, unknowing to the student, to the parent, or to the school employee, and then that leads to an overdose. And when you have an overdose, if Narcan is administered within a couple of minutes, it has a very strong likelihood that it can cause that person to start breathing again and save a life.
Mm-hmm. And is the funding to support this program, is it coming from the opioid settlement dollars program? I had the chance to meet with you sometime last year when you guys were releasing those grants to nonprofits throughout the state.
Yeah, absolutely. So the funding is coming from the Opioid Settlement Trust. Georgia's set to receive over $1 billion over the next 18 years, and this funding to pay for this program is coming from the trust.
Mm-hmm. And tell me, how will you guys implement this into the schools as far as training for the staff, making sure that it is administered correctly to save lives?
Yeah, so we're very fortunate to have a good partnership with the Georgia Department of Education. They're assisting us with the distribution. The distribution's occurring through the RESAs, the regional education groups throughout the state. We have shipped boxes. The boxes are fairly large boxes that'll hang on the wall. Inside the box will be 2 doses of Narcan, gloves, mask, etc. So those are being shipped all over the state to the RESAs, and then they're going to distribute them to every single school system in the state. There's over 2,300 schools in Georgia, so pretty massive undertaking. We're doing it in 2 phases. Phase 1 is underway now, going to half the schools, and the other half will occur in April of next year.
And in closing, you know, what do you want to tell parents, prevention, before it gets to the step of having to administer Narcan?
I think it's important for parents to understand the number one place that people become addicted to opioids is in their own medicine cabinet. So if you have unused medication at home, get rid of that, dispose of it properly, take it to your local pharmacist, talk to your local doctor, dispose of that medication so that your children, your grandchildren don't have that access.
Yeah.
The Georgia Supreme Court heard arguments yesterday in a fight over whether Fulton County District Attorney Fani Willis must testify before State Senate Committee. The committee is investigating how Willis used public funds during the 2020 election interference case involving President Donald Trump and others, a case she was later removed from. Willis argues the subpoena is unlawful, but a Fulton County judge has already ruled that the committee does have that authority. Her attorney, former Governor Roy Barnes, says the subpoena is now moot because the committee was from a previous legislative session. The court says it will have a resolution soon and wants an update by December 17th. So let's do a little deeper dive into this with a guy that we know very well, Daryl Cohen. Always good to have you on, a former assistant Fulton County District Attorney and current defense lawyer. Thanks for being here. So we know that Fani Willis, we heard from her attorney, she is going to eventually testify. But what was your reaction to this making it all the way to the Georgia Supreme Court and being argued there?
Well, Jonathan, this is a case of what we like to call first impression. It's disappointing it has to go this far, but it's probably necessary. Now, this is not, by the way, the first subpoena. We're talking before the Supreme Court is subpoena number 1. There's another subpoena that she is going to apparently utilize and testify according to Roy. And Roy Barnes, who is, as you guys know, a former governor here in Georgia, he knows the legislature and he knows what he can, cannot do, should not do. So it's going to be very interesting to see whether or not the Supreme Court says, yes, you have to comply with subpoena number 1, even though it's probably a moot point because she, according to Roy, is going to go ahead and comply with subpoena number 2. But either way, if she testifies, that is probably what is more important than anything else.
Yeah, because that's really at the core of this. Also at the core of the argument is whether a single chamber in the Senate, a Senate committee in this case, even has the power to subpoena a district attorney. So I know you've been in this a long time, this arena. How do you see this issue all playing out in terms of that, the subpoena power?
That's what's so very interesting, because if the Supreme Court agrees with the Superior Court judge and says, yes, she needs to testify based upon subpoena number 1, then we have a precedent that if the assistant district attorney, or in this case, an elected district attorney, chooses not to testify, then he or she will have to. If, on the other hand, the Supreme Court says, no, they didn't have the power, then it sets a precedent so that if this happens yet again with another district attorney at any time in the future, we've got the Supreme Court say no, but we don't know what they're going to say. We don't know it's no N-O or no K-N-O-W. That's what's going to be so interesting.
You know, Daryl, the interesting thing is I know a lot of our viewers may be watching and saying, wait, I thought the election interference case was dismissed, it's over, so why are we still talking about this? So does that make this subpoena that we're talking about moot, or is it still relevant?
It's still relevant because we don't know what the committee wants to know, and it's important to note that the committee is mostly Republican, if not completely Republican. Fani is a Democrat. That shouldn't play into it, but unfortunately, politics seems to play into everything.
Yeah, and that's true. A lot of people saying, is this really a legal fight or is this more of a political fight? And many would say it seems more political at this point.
To me, it's both political and not. This has been a war of attrition, and be careful what you ask for. Fani got involved in a major case which exploded over a period of time. Whether she had something to do with that explosion, a little to do, or a lot remains to be seen. But these are the remnants. Well, I like to say in a court, never happened before. It's predictably unpredictable. We're not sure what the future is going to hold, but we're going to find out.
Yeah, and we've never really seen this, at least not in Fulton County. So how does what's playing out reshape perhaps the relationship moving forward between district attorneys' offices and lawmakers?
Well, that's sort of what I was making reference to. You want lawmakers and district attorneys to be on the same side. On the other hand, there are legitimate questions of whether or not the elected DA is doing what we, the legislature, thinks the elected district attorney should do or not. And a cozy relationship is always better. Friends have a right to disagree. If you become enemies, the disagreements ratchet up, and that's what this seems to be.
New numbers reveal the human cost of traffic violence across Metro Atlanta. A new report shows hundreds of families grieving loved ones lost on our roads in 2024 and where the danger is hitting hardest. Let's find out what's behind this with Rebecca Cerna, Executive Director at Propel ATL, formerly the Atlanta Bicycle Coalition. Rebecca, it's great to have you on for an important conversation this morning. Thank you for your time.
Thank you for having me.
You know, when you look at these numbers last year, what jumps out to you as the clearest sign that traffic violence still very much a problem, maybe even a public health crisis here in Metro?
Yeah, what really struck us is that more people are killed in traffic by drivers than by gun violence each year in the 5 counties that we looked at. And yet we hardly talk about it. We hardly hear about it. And the solutions are actually pretty simple. We know how to prevent traffic violence. We know how to save lives on our roadways.
Okay, let's talk about some of those solutions. What are they?
Our streets today throughout Metro Atlanta are primarily designed for speed. We have wide lanes, we have multi-lanes, they're fast, they're straight. The crosswalks are few and far between, and yet people need to cross the street to get to the bus or the grocery store. And we have a lack of safe spaces like sidewalks and protected bike lanes for people outside of cars while encouraging speed. It's really just physics. When you have fast-moving cars that are getting heavier and taller every year, hitting other cars or people outside of cars, death is the inevitable result.
Yeah, if a car is hitting a person, a pedestrian, many times they don't stand a chance. And one thing that struck me from your report, I read it this morning, was that Clayton County saw pedestrian fatalities double, going from 24 to 57. Do we have any idea what's happening there with that?
Sometimes the year-to-year changes can really mask the bigger picture. And the bigger picture is that throughout these 5 counties that we looked at, people walking, people using wheelchairs are especially vulnerable. And any serious injury crash could be a fatality depending on the characteristics of that crash. So I think it's important to look at the overall numbers, and pedestrians are becoming less safe year over year, and that's something we're really concerned about.
And Rebecca, let's talk about some of those overall numbers right now. We have a chart here to show you. The report that you put out shows this 5-year moving average trending down. So when you do take a look at that bigger picture, what's working right? Any reason to be optimistic here?
Yeah, what we saw is that some streets, for example, Donald Lee Hollowell Parkway in Northwest Atlanta, the state installed some safety improvements on that, things like pedestrian crossings that are signalized and have a little space where you can cross one lane at a time. Drivers can see the pedestrians more easily, better lighting, things like this. Those actually had big safety improvements where those projects were installed. What we're not seeing is a sense of urgency to address this problem across the Metro Atlanta in all of our communities.
So you're calling for some government action here, but is there any kind of personal responsibility that drivers can take too? I'm thinking of all the distracted driving out there right now.
So as humans, we make mistakes, whether we're inside of cars or outside of them. What we need is for our roadway network and our systems overall to prevent those mistakes from becoming deadly. So when we can bring down driver speeds, if we do have people just having human error becoming a factor, they're much less likely to kill someone as a result.
You know something that can take human error out of the equation? Self-driving vehicles. And I'm curious to know if you have any thoughts on this, because Waymo just released some stats that shows it has 92% fewer pedestrian crashes when compared with human drivers, or so they claim. A doctor in the New York Times last week put out an op-ed about those numbers, saying that we may be on the path to eliminating traffic deaths as a leading cause of mortality in the U.S. He says, while many see this as a tech story, I see it as a public health breakthrough. What do you think about that, Rebecca?
It's something I'm following very closely. While self-driving cars and autonomous vehicles can't solve everything, they don't give us better transit, for example. If they can save even a few lives, it's definitely worth considering. One thing we do with our report each year is we highlight the human cost of unsafe streets. And so we looked at the stories of 3 individuals who were killed on our streets last year. And I think about what that means for their families, for their communities. They were all incredible people, and they left a legacy, but we could still have them. Most of these crashes are preventable. So technology that saves lives is so important. And I think, the more we can accelerate some of those technological improvements, the better.
And I like how you call them car crashes, not accidents, implying that it's not preventable. I recommend everybody go read your report and read the stories of those 3 people. They are one of hundreds in our area. For folks who are interested in reading it, where can they access this?
They can go to our website, let'spropelatl.org, or find us on social media. We'll continue to be talking about this issue because it continues to affect so many people, so many families.
New findings from the Giffords Law Center show Georgia gets a failing grade for the strength of its gun laws. Giffords' 2025 scorecard shows Georgia is one of 24 states that earned the lowest grade for having weak gun safety laws, as the state loses more than 2,000 people a year to gun violence, one of the nation's highest totals. Giffords' analysis shows states with stronger gun laws consistently have lower gun death rates. So let's bring some context to these stats with Lindsay Nichols, Policy Director for the Giffords Law Center. Thanks so much for being with us, Lindsay.
Thanks for having me on.
You're joining us on a morning, Lindsay, where right now a 9-year-old boy is recovering at Atlanta's Grady Hospital after being shot in the leg last night. A woman in her 30s was also shot here in Atlanta, and this is just one of a couple shootings we're reporting today. So, Lindsay, based on the data, does this reflect the reality of gun violence in Georgia right now?
Absolutely. Unfortunately, it does. Georgia has some of the weakest gun laws in the country, and as a result, they have a very high gun death rate, the 14th highest gun death rate in the country. So unfortunately, far too many families in Georgia suffer the loss of a loved one from gun violence. Day after day, we see people dying this way in Georgia, as in many other states in the country.
So diving deeper into this report where Georgia got an F from the Giffords Law Center, what stood out most in this year's analysis?
Georgia received an F because it has very weak gun laws. It hasn't passed many basic gun laws like one that would require guns to be stored safely so that children can't access them too easily. A law requiring a background check before a gun is sold so that dangerous people, like people who've been convicted of felonies or violence, can't easily obtain a firearm. Laws allowing guns to be removed from an individual in a time of crisis. These are laws that other states have, and Georgia doesn't have them. Georgia also does nothing to support community violence intervention programs, a proven way to reduce shootings. So there's plenty of things that Georgia could do but isn't doing.
Yeah, let's talk about how folks here actually feel about these gun laws. An AJC Atlanta Journal-Constitution, a poll taken earlier this year found 55% of Georgians think stricter gun laws would reduce mass shootings, but only 28% said lawmakers should pass them. So clearly it's a tough sell for Georgians. So Lindsay, what does the data say about the effectiveness of gun laws?
The data shows that these gun laws work. You know, we see this year after year in our scorecard where the states with the weakest gun laws have the highest gun death rates. But even more academically, we see researchers demonstrating that the kinds of gun laws that I've mentioned that have been studied and that many other states have passed do actually reduce gun homicides and gun suicides.
And there have been efforts to pass gun laws in the Georgia legislature, especially in the wake of the Appalachia High School shooting. Just this past session, a bill was tabled in the Senate that would have provided a tax credit for folks for taking certain firearm safety measures. So, Lindsay, when you look at Georgia's current laws, where are there other gaps?
There are so many gaps in the laws. One of the things Georgia did recently that actually lowered its grade is allow people to carry guns in public without a permit. You know, previously Georgia, like many other states, required a permit for a person to carry a gun in public. They no longer require that. So that lowered the grade because it weakened the gun laws. And that's one of many kinds of laws that we know can actually make gun violence worse.
ACA subsidies end on December 31st. That is less than 3 weeks from today. It is a deadline that could trigger sharp premium increase for millions. And again, these two plans are now being considered. The Democratic plan would extend enhanced ACA subsidies for several years, keeping premium caps in place and preventing price spikes for millions. However, the Republican, they also have a plan. The Republicans' plan would phase out the expanded subsidies and shift assistance toward health savings accounts, giving consumers more flexibility, but raising premiums for many people as well. So time to see what we can expect today. We've got Stephen Patrick, chair of Emory's Department of Health Policy and Management. Glad to have you here because there's a lot to sort out this morning. So let's start with the basics, Stephen. What exactly happens to these premiums on January 1st if Congress doesn't decide to extend these subsidies?
Well, if Congress doesn't extend the subsidies, we'll see millions of people will see premium increases. And so for people in Fulton County, for example, if you're a family making $75,000 a year, a family of four, you'll see about a $200 a month increase in your premiums that you pay.
All right, so, again, there's two different proposals here. We just kind of went through the details of them being presented on the Senate floor. What's the biggest divide, the biggest policy divide between them?
Well, first is just continuing the subsidies. So doing what we've had for the last few years to keep monthly premiums low for Americans who buy their health insurance on the exchange. And the other are health savings accounts. What the Republicans and what President Trump have proposed is taking money and putting it into a health savings account. And this is what health savings accounts do. They have a catastrophic plan coupled with a savings account where you can pay for individual care. The problem with that is that for most people, you have to have about $7,000 to fully fund those accounts. The proposals we're hearing are somewhere between $1,500 and $2,000 in those accounts. And the worry is that people just won't have enough money to actually pay for care.
Yeah, and we saw during the government shutdown both sides for weeks sticking to their points. So do either of these proposals have a realistic path of actually getting passed?
As of this morning, it doesn't look like either will pass. We're still at this place where there's appears to be a deadlock.
Okay, so we also got to talk about the insurers, and the consumers. Of course, perhaps most important. How disruptive is that for them when Congress is really waiting until the last minute? I mean, we are only just a couple weeks away from the deadline.
Yeah, for all of us, it's if we all had just a $200 a month increase. That's disruptive for folks, particularly right now as the economy is weaker, to try to just plan a budget. So that's disruptive for individuals, and certainly it's disruptive for plans too. Over the last several years, we see plans move in and out of the exchange where there's this, disruption in the market. We might also see others leave the market as well.
Okay, so if this doesn't pass, and as you mentioned, there's kind of a slim margin here for it to pass, could we see any type of short-term plan worked out before that December 31st deadline?
Quite possibly. We've seen people propose everything to a one-year extension. So I think everything is on the table right now, including short-term fixes just to extend the subsidies.
Mm-hmm. So who's going to be impacted the most by this? Are we talking about more lower-income families?
It's yes and. So the lower income families will have higher premiums to pay. The enhanced premiums that we saw during COVID and beyond also increased the ceiling to where additional people could get premium subsidies. So people will be affected. Certainly the people that have lower incomes, have less disposable incomes, will have the greatest effect on their families.
All right, so Stephen, as lawmakers will be debating this and perhaps voting on this as soon as today, what should people who are watching right now who rely on this coverage be doing? Is there anything they can be doing right now?
Well, I think one is to prepare, and two is to communicate. If you have, I think part of this is just us all talking about the Affordable Care Act and how we actually have insurance. The insurance system is really complicated, but I think this is where people can talk to their, talk to their neighbors, talk to other folks about how they get insurance to get the word out there, because this is a serious issue. And I would say probably a year ago, nobody even knew about tax subsidies. And so making sure we have broader conversations about how people are insured is important.